Well, I'm Ronald Moy. I'm a dermatologist. I specialize in cosmetic surgery and skin cancer surgery. So I do the full gamut of facial cosmetic surgery, facial plastic surgery. A lot of our practice, of course, is making people look better. A lot of our practice is also reconstructive, things that might, scar revisions, skin cancer removals. So with that, being here in Beverly Hills, we do a lot of fillers. We do a lot of laser resurfacing. We do a lot of lifting and tightening, whether it's neck or face. We do things that people sometimes may not realize that are non-invasive things. We can tighten the neck, we can tighten things non-invasively. So that's sort of the scope of our practice. My personal background, I grew up here in Los Angeles. I actually went to a 6-year medical program, which is 2 years of college, 4 years of medical school. I came back here and trained at UCLA. I did my fellowship at the University of Pittsburgh. I've been back as a UCLA faculty member for many years. And I practiced at UCLA actually my entire career since last year. So it was really more than 20 years at UCLA. And then I've been here in Beverly Hills for the last year and a half. Well, I never thought I'd relocate to Beverly Hills. I used to make fun of those Beverly Hills doctors, and partly it was because I was really interested in research, and I was interested in really the ivory tower academic medicine thing, where you have a lot of interaction with different specialties, and I still find that really exciting. However, being at a university hospital, it's sort of hard to do cosmetic surgery. People sometimes don't perceive us as cosmetic surgeons there. In addition, it was a hard place to work politically. The rent was getting higher, and actually here in Beverly Hills, there were some advantages just to get the space we needed. With new technology taking over medicine, we really need large amounts of space to house these lasers, to house all the new technology. So this was the one spot where we could get 8,000 square feet to house all the lasers. Well, I'm currently the president of the American Academy of Dermatology, and we have many diverse specialties within dermatology. We have those of us who specialize in cosmetic surgery, we have those who just do skin cancer. We also have dermatologists who don't do any surgery, who just do medical dermatology. So in a way, it's a big organization that requires, a lot of politics and a lot of trying to meld the diverse interests, but it's exciting. In that role, I've met a lot of people. I've had a lot of different experiences. I've gone to a lot of different countries. I've met a lot of different international people, and we have an organization of about 180 staff members, about 16,000 dermatologists. So just the numbers of managing all those people and getting everybody to work together and communicating has been a challenge, but I'm enjoying it. Well, that's a good question, because there's not exactly the average patient, but the most common patient is somebody who just wants to look better, look younger. Everybody feels, they feel younger than they probably look, is what they say. They often want to come in looking better for a wedding. They might look a life change. Maybe it could be a divorce or something. They may feel that they just want to take out some wrinkle lines. So that's sort of the most common complaint, and then they come up and say, well, what can you do? And so we'll give them a list of things that they could do, and nowadays people want sort of non-invasive treatments to start with, and then sometimes they move up the scale a little bit and have to do something that's a little surgical. But we always start off treating, advising things conservatively, as conservatively as possible. Well, I think everybody's practice during a recession has probably shrunk a little bit in terms of cosmetic things. I don't know if ours has much, in the sense that we do a lot of non-invasive things, and maybe that part has gotten bigger. So with new technology, a lot of the laser type procedures are really very little downtime. A lot of the fillers and things like Dysport or Botox are really just injectables. So that part of our practice has not gone down at all. Where maybe it's gone down to some of the more invasive procedures, whether it's an eye lifting or a face lifting, that maybe has gone down just a little bit. Although being in this area, you could also argue it really hasn't gone down much because people can afford things. But the practice of dermatology has changed, partly again because of new technology. More dermatologists are doing cosmetic procedures, and I think that has changed. And I think the public has perceived dermatologists as a specialty to go to, especially if they want to start doing conservative cosmetic procedures. So that's changed our specialty quite a bit. I do medical dermatology. It's not uncommon for somebody who I might have done a lift procedure on also to have, something, a rash or something on their face. So I do medical dermatology, although that's not my focus. think the most common procedures are laser procedures. Probably lasers for wrinkles. That's the most common thing. I mean, we have people who also come in lasers for brown spots and lasers for red spots, but I think wrinkles is the most common reason people come in. The technology's improved because the precision and really from a patient's point of view, the downtime has gotten less. So a laser that might have taken 2 weeks to heal if you were resurfacing someone's face now heals in half the time. Or something that took a week, we now heal in 2 days. And partly it's because this fractional component or this fractional type of laser where the little holes are placed, partly just all the instrumentation, all the technology has gotten better. So I think that, if we look to the future, there'll probably be more non-invasive things, whether it's, prevention things or tightening methods. I think all those things will get better and less invasive. A lot of the things when you talk about anti-cancer, which is part of our practice, and anti-aging, they sort of go hand in hand. So when we tell somebody that if they want to prevent cancers, in our case it's skin cancers, it's obviously sunscreens, it's the use of certain creams like DNA repair enzyme creams or use of tretinoin or retin-A can help on there. And then of course diet, the anti-aging diet, the anti-cancer diet is sort of the same, which is fruits and vegetables. It's not necessarily antioxidant pills that you're taking, but more so the things that you eat, the intake, and fruits and vegetables are at the top of the list. Now, you can take other things that may add to that. There's always, arguable, more or less scientific evidence on some of these other things. But certainly, I always talk to people about fruits and vegetables as, a main component of their diet that can help their skin. Well, our main patient, most of our patients are probably female. That's probably 9 to 1. Maybe 10% of our patients are actually men who also want to look better. And maybe that is increasing a little bit. I think men have, I know as a guy, I'm less likely to go to a doctor than my wife would. I think that's common in cosmetic surgery also. However, I think that the public is better educated. They know that there's things like injectables that could help this or help the little fine lines here. So we do see men, but predominantly it's women. We end up talking more to women. That's probably a majority of the patients I consult with every day. The mix, in Los Angeles here, I think there's more diversity, more ethnic diversity, so we certainly see all skin types. And nowadays with these new lasers, we can laser resurface on somebody who we used to think had too dark of a skin, like my skin, for example. We used to say Asian skin would be very difficult, and now we really don't think twice about lasering Asian skin because those chances of post-inflammatory hyperpigmentation is relatively smaller. Well, the most common thing that somebody comes in to me says they want to look natural. So the other side of it, the public understands cosmetic surgery, but they have the fear of some either celebrities or people that are on TV that look unnatural. And sometimes that's the old facelift that was pulled sideways, and they say, I don't want to look like that, And in a modern facelift, obviously, we are more likely to pull and tighten in a different vector, and it's more of an upward pull. Or eyes, in the old days we would take all the fat out and people would be hollowed out both on the upper eyelids, and they don't want to look like that. Or even something as benign as Botox, they don't want to look like completely all frozen. They want to look natural. So that's the most common discussion we have. They want to look natural. They don't want to look like they've had something done. They don't want to look like there's been an extreme makeover. And we always have to make sure that they know it's going to look natural. But the public most of the public understands a lot of the procedures when they come in. They already know. They research it. It's in all the women magazines. So, what they don't understand is what the magazines or television doesn't tell them. Things like this could happen, these are small risks, what their expectations are. Sometimes their expectations are that laser can just, erase everything, and it doesn't. Lasers, may reduce 50% of the lines or wrinkles in an area, but they're not going to remove all the lines. So, on somebody who understands that, it's easy. And then, of course, I probably spend more time not talking about anything like complications, but their expectations versus, what's realistic. So that's the hard thing. Yeah, that's a real good question about this volumization, because we actually did the opposite, when I started, and I've now been practicing for 30 years. So 30 years ago, we would take the fat out of here and not replace it, and on the upper lid take the fat out. And in the face, people didn't really recognize that, it's the loss of volume that makes us look older. So we would just be pulling tighter. And so now so much of the discussion is, yes, replacing volume, whether it's fat or using fillers like hyaluronic acid into these areas. And that discussion, it sometimes it's hard for people to understand that, but they generally realize that pretty quickly, putting volume in someone's face. So all the procedures that we do are, yes, commonly a facelift is combined with fat transfer, maybe fat transfer with stem cells that are partly in that fat transfer. And hollowing, when people complain of bags under the eyes, it's that hollowing out. We're putting fat or some filler in there. So that's a whole discussion that it's amazing that we didn't really recognize that some 30 years ago. We have we have some young staff members, of course. So you don't so many of our staff members are in their 20s. Obviously, that's usually very, very young. But a lot of our staff members have had some of the easy procedures, the injectables, and we've done blepharoplasties, we've done facelifts, we've done all the procedures. Basically, every procedure that we do is then done on a staff member from at a certain time. So yes. Well, 5 years, in a way, when we talk about strategic planning, 5 years ahead, things are moving so fast. But here, it's hard to recognize what's going to happen with new things. I would actually say I'm not sure a lot's going to happen in 5 years. I think the technology keeps on getting better, so we think that lasers will get better and there'll be less downtime, less complications. I think there, of course, going to be new fillers. That may not be so remarkable. There'll be new neurotoxins, maybe not that much of a change. Things will probably get a little less expensive with all these other companies, new market. This seems to lower the cost. People are putting a lot of reliance on stem cells, whether that really helps things. So that, that would be great if it did. Same with growing hair, growing hair in a lab, that might replace the modern hair transplants that we know it. If we could grow skin, maybe we'd be, instead of fillers, we'd be able to volumize without putting a filler in, an artificial filler. So I think those are possible things in 5 years. Probably in 5 years, things aren't going to change dramatically. First of all, it's great being a dermatologist. It's great being a cosmetic dermatologist. It's fun, it's exciting. I like going to work every day. But I'm not sure it's changing their lives. It's more helping them. And some of it's even psychological helping them. It's going in there and trying to do something that they want, or, if you're building a practice standpoint, it's trying to do something kind for them. It's trying to help them as a friend. And that's probably the easiest way to build a practice, is to go out of your way and help them. I have a daughter who's just finishing college and going into medicine, and I think she's going into medicine because she knows that, I like it, it's fun, she sees that when she's come here. I don't know if she's going to go into this specialty, but I know she changed when we went on a medical mission trip in Peru, and we were helping people, sort of pure medicine. We didn't have to write notes. We were just helping people who never even had, antibiotics or anything. And she got excited about that. But in a way, it's just as exciting here when you can make a change, and people are very appreciative. So I think it's more the helping people in some way, and changing their lives, changing their appearance is probably not what we're willing to do. In fact, that's the type of patient that sometimes scares us. When they say, "I'm going to change, I want the extreme makeover." We don't really do that. We make them look, slightly better. We make them look younger, but we're not exactly doing the extreme makeover. New You magazine is an excellent educational piece for the public, because you really do get past where some of the other magazines that are beauty magazines that come out of New York, they seem to not go into depth. They seem to sometimes be biased by who they quote, where New You magazine seems to get away from some of the conflicts of interest that some of the competing magazines do, where they, some company might sponsor an article and there might be favored toward a certain industry. New You magazine has done better than that. There's been less conflicts of interest or bias in the articles, and yet it's done a great job at explaining things for the public, such as volumizing or new lasers. So I think New You magazine is really helpful. It's great for a patient to read something about that, which is often in our office. They'll read something in New Year magazine, and then with that explanation, they're educated. And then they want to see, do you as a doctor think it's helpful to you? And I honestly tell them, yes, it could help you here or not. So I think New Year magazine is great, and I'm glad we have it in our waiting room. Yeah, I have some great colleagues. I have great partners. I have Dr. Eddie Fincher. He's an MD, PhD, finished his residency at Stanford. He does really the same thing that I do, and also my other partner, Lisa Chipps. We all really do the same thing. That is, we do the gamut of facial cosmetic surgery, facial plastic surgery. We do all types of lasers. We do all types of lifting and injectables. So, it's great to have partners, especially as president of the American Academy of Dermatology, where I'm on the road this year at least a bit more, and they take great care of patients. And then Dr. Helen Fincher is a medical dermatologist who does cosmetic procedures like injectables, but not all the other invasive procedures, and she's also great. In our practice, we have two other dermatologists, Dr. David Risch and Dr. Ron Kotlier. Dr. Ron Kotlier does pediatric derm, and Dr. David Risch is a medical dermatologist. So we have, a good group of doctors here. I'm proud to be with them, and it's great to interact with them. It's fun. Well, it's easy, all of us who get to a certain age, we look back and say, gosh, I used to know so much, and then as we get older, we feel like we know less, because it is, as you point out, an art. And part of the art is interacting with people and knowing how to say things. I think I'm better at it than I was. I'm probably a better listener. My skills are certainly slightly better too. I think that, maybe doing a procedure like a lifting procedure or a facial plastic surgery procedure, I could do it 25 years ago. But with the experience, you know when to anticipate. Medicine isn't that complicated. It often is who does a lot of procedures, and we're lucky here we do a lot. So the art of medicine is really the hard part, is how to handle the patient, how to make them feel comfortable, how to make them know that you're going to do the best do the best you can for them, that you have all their interests, that you're going to be honest with them, that all that. And I think I'm much better at that. And that, I think, is the real art of medicine. And then the skill part, we learn in residency. Some of the procedures we even learn as things go on and new technology is. That's the science of medicine. And yeah, you could train a robot or a monkey to do that. Yeah, in aesthetic sense, I mean, people talk about the artist, plastic surgery, it's molding, it's, there is that. I think sometimes that's overemphasized. We are technicians more so than artists in some sense. I think it takes good judgment, good surgical judgment. We are not, molding a new face. That I think is, some people try to perceive themselves as a plastic surgeon who molds a new face. I don't think we're like that. We try to keep the face exactly the same and make it slightly better. It might be, slightly tightening, but we're not changing around. We're not an artist like, my wife is an artist who can do a painting. We're not like that. I'm not an artist. I'm a technician. I can make things better. I have a science background. I'm going to tell people honestly what can or can't be done with the minimal risk that exists. So I might say I disagree a little bit with that. We're surgeons who are technically well trained, and I'm a person behind that who's going to tell somebody exactly what they need, and I'm going to tell them honestly. So I think I'd look at it that way. I'm Dr. Ronald Moy. I'm a board-certified dermatologist and board-certified cosmetic surgeon. I practice here in Beverly Hills, and my practice consists primarily of facial cosmetic surgery, skin cancer surgery, skin cancer reconstructive, and a lot of different smaller procedures such as non-invasive injectables, non-invasive laser treatments.